which comes first, planning for traditional public health emergencies or planning for SNS? How many of you have ever actually had to call and request the SNS? Don't get me wrong, it's an important asset and we need to plan for it, but in my experience, it's more often that we see weather emergencies and other natural disasters, all of which have public health implications. It is these incidents that prepare us for our SNS planning and ultimately for our LTAR. The LTAR is an important tool that I like to call an exercise in documentation. Our planning starts with our own staff and looking at our building evacuation plans, training on those plans, and exercising them on a regular basis. Everyone is very familiar with fire drill concepts and those sorts of things. It gives staff an awareness level of emergency preparedness and its importance, and also helps build a foundation for other types of emergencies. Our outreach in the community helps us establish relationships with our response partners, our volunteers, and our community members. We provide actions that they can take to prepare themselves for a weather event, power outage, heat wave, or snowstorm, all of which we've experienced in the past few years. We may also mention some of those scarier things like anthrax and terrorism, but we find when we're educating the public, it's best to stick to the basics. Our community comes together for events such as the EMS Memorial Bike Ride, when we honor those we have lost. As a volunteer with EMS, I'm part of their family in addition to my day job as part of public health preparedness. These established relationships are key when it comes to section 1.4 of the LTAR. We do not have one annual SNS meeting with our partners because we're meeting with them almost every day and we're talking about all different types of emergencies, some of which include SNS, but the majority are weather events. We also come together when one of our own is injured, which happened just a few weeks ago. Officer Peter LaVoy is still in the hospital in stable but critical condition after sustaining a gunshot wound to the head. Just last Sunday, over 3,000 of our community members came together and raised $75,000 for his family. Flu is something we all respond to on an annual basis, and it gives us a chance to test our plans while also providing a valuable service to the community and protecting their health through vaccinations. Our volunteers largely support this effort, and it gives us a chance to test our medication dispensing plans. As a result, these plans have improved and our partnerships have been strengthened. H1N1 also gave us the opportunity to test and improve these plans. Here we have our police department providing site security at a vaccination clinic and a fire department volunteer assisting and giving out tickets for vaccinations. These partnerships are reflected in our LTAR and make asking for site security at our pods much easier when they've already been through it. Our area experienced several major snowstorms in 2010, and many of the lessons learned from this response just after H1N1 ensured that we were more than prepared when it came to documenting processes such as hospital coordination and use of ICS. Mark Barbieri already mentioned the derecho storm, so I don't need to go into the details, but this hampered our communication pathways with our hospitals and our nursing homes so much that we had to physically go to our nursing homes to find out how they were doing. This strengthened our bonds with them immensely and makes it much easier for us to go to them and ask them to be closed pod partners in our SNS planning. Hurricane Sandy was not as disastrous for us as it was for New York and New Jersey, but certainly having our EOC activated helped us continue to strengthen our partnerships and to test all of our response plans. We have 3 fire department volunteers, actually 3 of probably 5 different fire department volunteers that responded to Sandy, and they are also mentioned as pod leadership in our staff assignments for LTAR, just to show you kind of how people cross over into different roles. These people have been trained in how to lead a pod in addition to their role with the fire department. So all of these real-world emergencies and planning for weather events have made us more than capable of fulfilling all of our LTAR requirements. And as a result, we've completed a closed pod exercise with our fire and EMS friends and are planning to do one also with our sheriff and police, all agencies that do not consider anthrax planning their top priority. But most important is that we still take time to have fun when we're preparing for and responding to these threats. And I truly believe that it's these partnerships and planning that enabled us to get a score of 100 on our LTAR.